The adrenal cortex produces other hormones, but the most prevalent, the largest quantity are the corticoids or corticosteroids, which is either glucocorticoids, the anti-inflammatory, or mineral corticoids, the pro-inflammatory. So, Carmen, could you read the Bible? And this is in the Bible for a long time, but unfortunately, although it was sent over to the Romans, peace is not allowed in most of the countries, not even in the Middle East, like in the West. Here is another interesting young case, which is related to pharmacology. The 88-year-old John, Dr. Katina Rieger, could you read the case?
8-year-old Johnny finds that he can barely catch his breath at times, especially while exercising. His asthma comes and goes, but on therapy seems to stop the asthma attacks completely. Although his doctor is concerned that it could stunt Johnny's growth, she eventually prescribes oral prednisone, a glucocorticoid analog, and tells Johnny's parents to make sure he takes the medication every day. After a few weeks, Johnny's asthma attacks subside, and he is able to have a fairly normal childhood. During this time, the doctor pays close attention to Johnny's linear growth. 2 years later, Johnny's doctor.
Okay, stop there. So, anybody else seen this kind of case? Allergic boy? You heard about peanut allergy? Extremely frequently. What is prednisone? Glucocorticoid analog. How is it stronger than cortisol? How much stronger? A lot. This is right at the end of your life, both by us, quizzes, and the boards. The classification of glucocorticoids, which is stronger, which is weaker. Start always with cortisol or cortisone, number one. That was the first discovered in the 40s and 50s. But cortisol is natural, but not very strong anti-inflammatory drug. A further problem is that it's not pure glucocorticoid, it has a small mineral corticoid activity. Prednisone and prednisolone were the first synthesized in the mid-1950s. And they are 5 times more active than cortisol. Write this down because I will drive you and others drive you crazy even more. So cortisol 1, prednisone 5 times. What is another even more potent glucocorticoid? I'm sure some of you heard about it. Which one? Prednisone and prednisone are always the same, 5 times, 6 times. But there are other ones which are 20 times more active. No, prednisone is probably less than 5 to 6 times more active. But others come. Our patients with IBD are treated. Much stronger. You heard about dexamethasone? Good morning, yes. Dexamethasone and betamethasone. 20 times, 25 times. So please remember this, write this down because again, not only me but other people will drive with this. Then we know this. The cortisol 1, prednisone, methylprednisone 5 times, dexamethasone 25 times. And there is one more, the triamcinolone, which is 25-30 times more active and has no mineral corticoid activity. Very pure glucocorticoid. So, don't start this kind of severe attacks with cortisol because it's not effective enough. Start with prednisone because it's usually patients respond to it. Dexamethasone should be the last option. Okay, so what was the continuation of your Shelby, could you read the 2 years later what happened to Johnny?
Yes. 2 years later, Johnny's doctor, this time the doctor pays close attention to Johnny's linear growth. 2 years later, Johnny's medication for him. Johnny switches to the inhaled glucocorticoid, oh my gosh, and discontinues oral prednisone. 3 days later, he develops a respiratory infection and is brought to the emergency department with low blood pressure and a temperature of 103. Based on his history of prednisone use, Johnny is immediately given hydrocortisone, oh my goodness, through IV, is as well as saline infusion. Johnny recovers and for the next 6 months slowly tapers his oral prednisone dose with continued use of inhaled glucocorticoid. He eventually is able to take the inhaled glucocorticoid alone as an effective therapy for his asthma.
So why did he not switch from oral prednisone to inhale? What is funny?
Not usually.
Why did they switch from inhale?
You didn't even say intravenous.
Why did they switch the oral prednisone?
Faster onset.
Which one?
Vocalization and faster onset.
Faster acting, exactly. Faster acting and less side effect. So inhaled is preferred. Why did it get trouble with low cortisol? Because if you take glucocorticoid, it suppresses ACTH, normal cortisol level. So if you suddenly remove the synthetic glucocorticoid, patients still have low ACTH and cannot secrete enough cortisol, which is a natural defense against infection. So you have to taper off gradually prednisone or any glucocorticoid derivative. Do not suddenly stop. So why the cortisol analog such as prednisone used for asthma? Because it's more active than cortisol. Why did they adapt cessation of prednisone precipitation clinical presentation of the emergency department? Because suddenly stopping prednisone patient ACTH level was low and it determined natural glucocorticoids. And Amy said why inhaled are better because that's faster acting and less side effects, and that's important to the long-term effect. Why did they not inhibit monitor linear growth? Because glucocorticoids affect the whole growth also. So what we will do very quickly is that just briefly mention the cellular origin of glucocorticoids and mineral corticoids and reinforce this. This is the most important thing that to learn that it's not enough to say that patients give steroids, as I emphasized yesterday. Even corticoids is not specific enough, but glucocorticoids. Yes, it's more troubling to pronounce, but please practice it. Glucocorticoids. And mineral corticoids are pro-inflammatory. And this was developed in animal models, but it has clinical implications also. And I will briefly touch on the discovery of the effect of corticoids on inflammation and who got the Nobel Prize for this. And there will be surprises. And the backbone of the natural cortisol is essentially model for the synthesis of new glucocorticoids. And the synthetic glucocorticoids, now you know, 5 to 20 times more active than cortisol. And they give you very quickly a pharmacological indication of all this. So, what is 5 times more active than cortisol? Which one? 5 times. 5 times. 5 times. Prednisone or methylprednisone. And what is 20 times more active than cortisol? Dexamethasone. These are absolute.
Oh, I was wondering, I just showed them this because this is what I found.
But there are several things, but usually start with cortisone. There are 4 to 5 steps. There are several versions, but what I don't like, some pharmacy teachers do this, start with the most potent prednisone or dexamethasone at 25, and they go down to prednisone, to prednisone and glutazone. Much easier to start with the natural one. Cortisol 1, prednisone 5, beta-dex about 20 times. I'm not going to go into detail because, as I told you, you will have less time. Just to remind very quickly, which we discussed yesterday, that the solar glomerular produces the mineral corticoid, fasciculars, and glucocorticoids, and reticularis, mostly the androgens. All this classification was introduced in the 1940s, early 1940s, by Hans Selye. So here are the glucocorticoids are indicated with two main purposes. One is the replacement therapy for adrenal insufficiency, either this Addison disease or any other infection. Nowadays even HIV causes inflammation under the cortex. These are more commonly used as glucocorticoids because glucocorticoids are natural and not enough. Don't have enough power to suppress inflammation and immune responses. And the most frequent diseases requiring these treatments are asthma, like this chronic is demonstrated rheumatoid arthritis, which we will review with you at the end of your second year or your third year, and for organs of injection after transplantation, because organs are very often, even if they're matched, require immunologic control. Mineralocorticoids are used for the hypoaldosteronism, which is a rare condition, but actually aldosterone is not used pharmacologically because the liver converts more than 35% oral aldosterone is an inactive metabolite during the first class metabolism, so there are other derivatives for it. Now, I mentioned this yesterday, and in this short review, I'm not going to go over all these enzyme inhibitors, but the most important are the 11 beta hydroxylase putting, or the 11 K2 position, the hydroxyl, and the 21 and the 17 hydroxylases. And here is the major things that again reinforce that these are glucocorticoids are anti-inflammatory, mineralocorticoids pro-inflammatory, all discovered, not in patients of course, but in animal models, all described, published in the best medical sciences in the early and middle 1940s. And remember the year, early and middle 1940s, published in the best journals from Hans Selye. And how he did it? He showed that giving excessive desoxyprotein acetate, which is the natural mineralocorticoid, you have inflammation produced in the blood vessels and in the heart. Essentially, it resembles the rheumatoid cardiomyopathy produced in rats. These are the enlarged hearts. This is the controlapse and contromesentery, and the enlarged hearts and edema of the lung, all produced as a syndrome of this artificially induced inflammation by mineralocorticoid excess in rats. And if we treated with cortisol or ACTH, this periarteritis nodosa, meaning periarteritis inflammation of the pancreas in any vessel, this is the DCA, mineralocorticoid induced massive inflammation. These dark blots are all inflammatory cells. If you take cortisol, you completely prevent seizure. So after all this work, in animal models, they used that in the 1940s in patients also. This is the effect of cortisol on rheumatoid pancreatitis, pericarditis in patients at the Montreal General Hospital. This was the massive edema for the rheumatoid arthritis patient. So these are not animal models, but are patients treated with cortisol or ACTH. The X-ray images improved. Furthermore, temperature went down, pulse went down, respiratory increased, and all these laboratory findings improved drastically after ACTH in acute rheumatic fever. Now, why did they use ACTH in clinical, not cortisol, in 1914?
The half-life?
Because there was no cortisol. There was no cortisol at that time, was just isolated from plants and was very difficult to synthesize. ACTH is 35 amino acids polypeptide. It was easily available and they used it so. No cortisol, but we used ACTH injected, which stimulates cortisol level. So after all this work in Montreal, you think who got the Nobel Prize? These three guys. One was Kendall, who tried to synthesize ACTH and the cortisol also, and Reichman, and the clinician for Mayo Clinic, Dr. Hensch, who did nothing else but read the literature from animal models and gave ACTH to patients at Mayo Clinic in Rochester, and God knows what a surprise, patients improved. And Sally did not get anything. So this is one of the big miscarriage in scientific. It's not the first and probably not the last. He did not get the Nobel Prize despite spending 10 years. And the clinicians were not done anything. And he was an MD, so I'm criticizing my group of people. Just read the literature, give ACTH, and voila, patients improved. Now, of course, they could have given Sally fourth, but why he didn't get it? Probably you know from news, maximum three Nobel Prizes can be given out in any category. 3 in physics, 3 in chemistry, 3 in medicine, physiology. So there are absolutely limits because it was Nobel, Alfred Nobel who put this in this declaration that best scientist, but maximum 3. So Sally was excluded, unfortunately. So let's take a break here, and this is not only that, but the Nobel Prize lecture, and she created a crazy story without quoting much of myself. So let's stop here.